Welcome to Venice, a city like no other. In a city where history meets the future of medicine. A unique forum for innovation, collaboration, and excellence. Meet the expert, May 9 and 10, 2025.
Here live back again with Larry Lenke, Professor Lenke, the amazing professor who was stolen by all the participants asking for a picture, showing you cases, searching for consultancies. So Larry, the event is gonna finish.
Right.
I would like to have a final, evaluation of this experience.
Sure. It's just been fantastic. I really love this type of meeting that's very focused, number one, has a very focused educational mission to dive into very deep clinical details on complex spine surgery in a very intimate setting with a size of a meeting, both of faculty and attendees, that allows for very intimate discussion, very open and forthright discussion, which, again, we don't have in many of our meetings, so they're just too large. And they don't allow enough time. You've done a very great job. The program timing has been great. Allows for plenty of discussion following the talks, and question and answer periods, which are so important, because those are the times often in Q&A where the points presented in the lecture are really expanded upon, and I think then the clinical pearls that and details that are presented can be magnified and really improved upon. So really an incredible experience, and I give the organizers credit, and it's just been a wonderful experience. Again, I judge a meeting by how much I've learned. If I've learned a lot at the meeting, then I know I consider that a success, and I've learned a ton. So as you know, we never stop learning, and that's why I enjoy not only speaking in these meetings but also attending, because I'm learning, and I'll be a better surgeon next week because of it.
Thank you. The following question is about what you learned.
Right.
If you should summarize or list quickly what your take-home messages from these days.
Number one is that yesterday there's still many different ways of treating adult spine deformity. I think Heiko Kohler's presentation on the very common older adult the degenerative deformity patient that is, again, has a very poor quality of life because of his severe trunk deformity, presented with multiple ways of treating it. Not only approaches, but where we start. Everyone would stop in the pelvis, but it's interesting that even in 2025, with a relatively common spine deformity condition, that there's multiple ways of treating that patient, and which is good. But as you know, in any area of medicine where there's a high level of variability, the results aren't as predictable. So I think we need to get to a point where we have enough data to provide more consistent solutions. Now, it doesn't need to be one solution, but maybe only 2 or 3, not 5 or 10, because that, to me, the variability is still too large to provide for consistent results and outcomes, if that makes sense. So I think that's what I've learned, that we still have a ways to go, but that's why we need the meetings. But that's why also I think the next big advance in our field will be analyzing big surgical data from the past to give us parameters to how to limit our variability in analysis and in treatment. And I think that will be the next major breakthrough to provide more consistent results, especially for adult deformity that has still a very high complication rate around the world, as we all know.
When it comes to severe deformities, very big problems, hands still matter nowadays when you do degenerative or very mini-invasive surgery. Which is your point of view about augmented reality or artificial intelligence? You already spoke about data, the importance to collect and to analyze them. But which is your point of view looking at the future of this profession?
Yeah, so I think the future is a little bit unknown right now. I think certainly advanced technologies, AR, VR, will be very helpful in the training of our future generation of surgeons, and is already being used, during surgery around the world as well, but in a very limited capacity right now, and mainly for minimally invasive degenerative surgeries. I think there will be increased use of that in other areas, including maybe complex deformity, but the uptake of that, I think, is going to be slower, and I give that reason because if you look at even minimally invasive spine surgery, it's been around my entire 34-year career, But at least in North America, it's still only 15-20% of all degenerative spine surgeries are done through MIS approaches. The vast majority are still done through an open approach. Versus if you look at other areas of surgery, let's say general surgery and like laparoscopic cholecystectomy, within 2 years of introduction of laparoscopic techniques to take out the gallbladder, 99% were done laparoscopically. That's not been the same in spine surgery. Spine surgery is different. I think the combination of the anatomy, the combination of bony and neural anatomy, the complexity of the segments, and just makes spine and the vascular structures, the surrounding structures, makes spine surgery a little bit more challenging from a MIS perspective to really kind of make a lot of significant improvement and adoption, universal adoption, which has not been the case, right? Which is kind of shocking because almost all areas of surgery that when some surgeons perfect MIS techniques, they become universally adopted, but that's not happened in spine surgery. So I think the adoption, in other words, will be a little slower, but it's going to happen. I mean, things are going to change. We are going to have assistive technologies that make surgery more reproducible. Again, just like the indications for what to do needs to be less variable, the techniques during surgery, intraop, have to be less variable to have more consistent results. So I think that's going to be the next wave. And whether it's AR, VR, robotics, navigation, whatever it is, everything tied in to make a intraoperative environment that's more consistent around the world. The problem is the expense. And that's, I think, going to be the limiting factor in all this. Honestly, it's very expensive to translate all these technologies into the OR consistently around the world. And so that, to me, is the biggest challenge we have going forward.
Thank you. Many participants say we are so interested in knowing which kind of life Larry has, his routine. I mean, we do know that surgeons work very much with their body, and keeping the body in good health, in good shape, it's crucial. Right. What do you do to stay healthy?
Sure. Good question. I'm not perfect. I think I've been always pretty good about my diet. I have a relatively good diet, which I think is important, and we know the value of that is becoming much more noted now. I've always been very active. I used to be a runner, long-distance runner in the distant past. Not the last 10, 15 years, though, but I do still like to get some type of aerobic exercise a few times a week, whether it's elliptical or I use a Peloton training bike now. But in the last 10 years since I moved to New York, I've also incorporated working out with a trainer. So I do strength training 2 or 3, ideally 3 times a week, realistically once or twice a week, but where I do upper, lower body, and core strengthening, which is we now know from data that leads to a much healthier lifestyle and decreasing aging or minimizing aging over time. So I think that's important. The challenge is that we have very active lives as deformity surgeons. I'm on my feet. I'm working with my arms and hands, and so what we do is not a desk job. So it is kind of challenging, and that's why I think one thing that is very important is getting the right rest and sleep. And for many years, I was not very good about that, and I had a health issue because I wasn't getting enough sleep. So I always tell my trainees that you're going to have a busy life. You're going to have there's never going to be enough hours in the day to get everything you want accomplished, but don't minimize your sleep. Unless you have a special gene that allows you to get only 3 or 4 hours of sleep, which very few people do, you need consistent sleep to be a healthy person long term. And that's one kind of wake-up call I had about 7, 8 years ago that I realized that I need to prioritize sleep as well as healthy eating, exercise, and to be a healthy person. Because again, if I'm not healthy, I can't help people doing good surgery, right? So we all have that challenge. And as you get older, it gets more challenging because I'm probably not as efficient as I was 10, 15 years ago, but I still want to accomplish even more. And you have to also realize that something has to give. So I'm finally getting to that point in my career where I realize I can't do everything. I don't want to do everything. I'm going to focus on what's important to me and my patients and my family. And I think that's you have to have that realization as you get older because your body and your mind won't allow you to accomplish what you did 10 or 20 years ago, and that's okay. I'm okay with that now. 5 years ago I wasn't, but now I'm okay with that.
The last two, thank you very much. It's very interesting. The last two questions are about the cultural diet. We do know that you are not only a very well-educated person in your field. I mean, you classify the pathologies and something like that, but you are very curious and open. Why culture in general is important? Yesterday, looking at your eyes when the concert of the youth orchestra was going on, I noticed a real interest.
Yes. Well, again, I think it's just fascinating to learn, to have these children at age 3 or 4, just basically be handed musical instruments and start playing with them and getting the ear and brain recognition of what music sounds like before even formal education to become master musicians is fascinating. But that's really the magic of our knowledge gain and our educational process, that sometimes we have to rethink that. It's interesting, in many areas you cultivate your craft starting at a very young age, but as surgeons who really don't do surgery till you're much later. Which is very interesting. And then you kind of choose whether you want to be a surgeon or not, and you really don't know whether you're going to be a good surgeon or not at that point in time, right? Based on, there's no test of three-dimensional anatomy. There's no test of hand-eye dexterity that we apply to allow surgeons to become surgeons. And that's where I think, assistive technologies in the future will even allow surgeons that maybe don't have the best 3D perspective or hand-eye dexterity to still become good surgeons, when now sometimes they aren't as good as surgeons, and I think there's high variability in that as well. So I think the future is going to realize that we need to start assessing future surgeons' capabilities earlier in medical school, even, or even in college, to see and encourage those with the right genetic and physiologic makeup to become surgeons. I think we have never thought about that, but I think that's what I've learned by even listening to the orchestra players last night. And these teenagers, I closed my eyes and it sounded just like the New York Philharmonic Orchestra to me. I mean, these were a group of 15-year-old musicians were doing phenomenal, right? I mean,
Indeed.
So it's really fascinating.
In my book, I did interviewing people. I asked those leaders if they could choose 3 people to have a dinner with. Mm-hmm. It doesn't matter if of the past, of the current times, or professions. I mean, without thinking too much, and because it gives us the idea of what or who really believe can be for you inspiring. Mm-hmm. Which people or who you would invite for a couple of hours having dinner or discussing?
Mm-hmm. I would think that's a great question. Well, I mean, being very Catholic, if I could talk to Jesus Christ, I would love to have met Jesus Christ and spend some time with him.
What you would ask?
I would ask him, how do we encourage society to be as peaceful and non-aggressive as possible? People, I guess, we come from animal derivations where you have to survive by being cruel and mean and attacking. But obviously in a civilized society, we don't need to do that, but yet we still do. And that really frustrates me. And even in the level of one-upmanship of even, some surgeons' bravado and being, having a big ego, whatever. It's not just physical force, but even like mental force. Why do we need to be like that to achieve our best? I don't see the reason to do that. So I would ask him how are we programmed? Why are we programmed to always kind of, for many of us, to kind of be charged with being aggressive and not non-aggressive? Because I don't think that serves a great purpose. That's what I would ask him, and amongst other things. But I think another leader that I would like to meet and have a discussion with would be Mahatma Gandhi. I think, who I think again was very, very impressive and a leader of very moral character, and also I think let's see, who would be my third person I would want to meet. I would. I have had the luxury of sitting down and speaking with this person, but I would like to do it once again, God bless him. But Jean Dubuffet. Jean Dubuffet was, to me, one of the most smartest individuals I've ever met. But also, again, his presence and attitude was one of calming and solution-oriented, I think, academia, but with a non-aggressive approach. He was always very humble about things, but he's also thinking at such a high level and wanted to inspire people to do their best by having them think at a high level. So I was fortunate enough to have a few conversations with him, but not as detailed as I'd like to. So actually, as you know, he just passed away this week, and so he's on my mind right now. So I would love to have a conversation with him about basically how, what drove him, what made him successful, and how he felt about how we should educate and treat the next generation of spine surgeons. I think it'd be be very, very inspiring to talk to.
This was about culture. The last side was about family. You mentioned your family. What family gives professionally to a surgeon like you?
Yeah, it's indispensable. You know, starting with my parents again, who obviously brought me up in a model of I think focused on work, treating people well, and also being family oriented. My family was family oriented, so that's the way I grew up. So it's easy to pass it on to your current family when your previous family was very family oriented. Currently, I was fortunate to meet my wife now of 36 years, Beth, when I was an intern back in St. Louis. We kind of connected right away. I told her on our second date that I was going to marry her, and thankfully she agreed, and that came to fruition. And we have 3 wonderful grown children, all living with us now in New York, 2 married, 1 getting married. My first grandchild born 5 months ago.
Wow,
so that changes your perspective. I mean, again, that's why I said, I obviously enjoy coming to meetings like this and educating and doing surgery. But I've always enjoyed being with my family, love being with my family. But honestly, that's becoming a higher priority as I get older, because I'm realizing, my days are more limited. Every day I live, there's less of my life to live, and so you got to spend your time wisely, right? So I'm trying to figure out ways of spending more time with my family and enjoying them, and making sure that I impress upon them. I think the legacy that I was left to my family of putting family first and being a really good person, being ethical. You don't necessarily need to be Catholic. You just need to be a good person. You need to have an attitude of service to others, and be comfortable with what you have. That's we always wanted to have more and do more, and sometimes that doesn't really lead to any more happiness, as you know. So I'm at kind of an inflection point in my career right now, getting more senior, still loving what I do, but realizing my peak years of doing the most surgery is over. So I want to basically, my legacy now can be educating the next generation to do better surgery, because my days are limited doing surgery, and I respect that, and I'm okay with that. So I think my goals are changing in the latter part of my career, and it's interesting. It's only the last 5 years or so that I'm realizing that, and my attitude towards my family is changing as well, but all in a positive way.
I had an amazing interview with Ellen Langer. She's a tenured track professor at Harvard.
Mm-hmm.
The mother of being aware, being there.
Right.
She imported in Western society this Eastern understanding.
Right.
And she says that the solution she found, she's around 80 now,
Mm-hmm.
it's to active noticing what you are doing. I
Right.
was seeing you giving the same attention to people asking you for a picture or for a suggestion about a specific case with the same level of concentration. So my last question, being concentrated, being there.
Mm-hmm.
This is a way to be happy, as she says, Ellen Langer?
I think so. I think, again, that I'm a half glass full guy. I always look at the optimistic component to life, not the negative component, which is easy to go down to. But I think that leads to less happiness. And I think, if we're happy and satisfied in our life, I think everyone benefits. We benefit, the people around us, our family benefits. I think our colleagues benefit. I think you're more productive. So the yin and yang of life, I'm very cognizant of that. And I think we only have one life to live. We have to give it our best shot. I've been very fortunate to put in a situation where I've devoted myself to a very niche part of medicine and surgery, and have, through my experience, been able to, I think, do a very good job with that, and not only myself, but to educate others in that area. But again, it's only because I've had support systems. I'm lucky. I'm the luckiest person in the world. I had a family life that allowed me to get the education I needed to get the knowledge I needed to do what I do. I had a family then when I started my career, my wife and my children, who allowed me to not only spend a lot of time at the hospital, but to go around the world and gain education. Because my initial trips when I was younger was for me to gain. Even though I was teaching, I gained more education than I gave. Honestly, maybe now that's not true now, but it certainly was early on.
Well, yeah.
But I thank my family for allowing me to do that, because that's how you have to go away. You have to go see other things to be able to kind of develop a total vision of not only the analysis but the treatment of these complex conditions. So I'm very lucky. Also, I've been very lucky. My health has been good, that I can consistently do these complex surgeries and still enjoy other parts of my life. And so you have to have everything kind of fall in place. And I thank the Lord for that and God for that, because there's a lot of people that have a lot of talent and ambition, but they get sidetracked. Sometimes not on their own fault, but they have either social, family, or personal or health issues that don't allow them to reach their full potential. I've been very lucky to reach my full potential based on being just fortunate. Obviously, you have to work hard. A lot of people work hard, but a lot of people work hard and still can't reach their full potential because other things sidetrack them, and they, whether it's personal, family, or health issues. And I've been very fortunate in all those realms to be able to succeed at my level. And but again, some of that is just luck. It's not my doing. So there's some greater being in control of this, and I think that greater being for allowing me to reach my full potential.
Who is fortunate should share, also should give back something to the community, and what probably you do is also a way.
Exactly. My family and I are very good about that. We definitely are give back to society, and less fortunate. We're very, been very blessed also from a financial perspective to do very well. So we're very big. We have a foundation, and we give back to charitable needs, and there's a lot, as you know, in the world for that. So I think it's all about being true to yourself. Being ethical and making sure you kind of look at the big picture, not just personal success, but global success. If I'm doing a great job with spinal deformity surgery, but no one else is, then that's not good for our profession. So I want every patient with a deformity being treated around the world to have a successful result. That's my main goal, and it's an ambitious goal. We call it a BHAG, big, hairy, audacious goal. But I think that's ultimately, before when I retire, that's one of my main goals, is to make sure that spinal deformity surgery is done around the world as optimally as possible, because all these patients deserve that.
Amazing. Thank you very much for these personal messages that are very important for everyone. I think it doesn't matter what we do. It doesn't matter at which level. We need to have in mind the big picture instead of our professional, so-called individual success.
Right.
Thank you, Professor Lenke.
You're welcome. My pleasure. Thank you so much.
Have a safe back.
You're welcome. Take care.